Your blood count explained. Here is a test you have almost certainly had. You feel a little off, or it is just a routine check, and the doctor says, let us start with a CBC. A small vial of blood, a day's weight, and back comes a page covered in short forms and tiny numbers, some of them flagged in red. For most of us, that page is a quiet little panic. So today, no fear, just the why. Because the CBC, the complete blood count, is one of the most common blood tests in the world. And in India, the single thing it uncovers most often is anemia, which quietly affects more than half of all women. Let us learn to read it calmly. So what is a CBC really? Strip away the short forms, and it is something wonderfully simple. It is a head count. Your blood is not just red liquid. Floating in it are 3 families of cells, each with a different job, and a CBC simply counts them. It's how many there are, how big they are, and how healthy they look. That is all it is. Not a verdict on your bodies. A snapshot of your blood's 3 workforces. Let us meet those 3 teams, because once you know them, the whole report falls into place. First, the red cells, by far the most numerous. Their job is to carry oxygen from your lungs to every corner of you, and the cargo they carry is a protein called Haemoglobin. When you have too few, that is anemia. The second, the white cells. These are your defense force. They rise in number when your body is fighting something, so they are a clue to infection. And third, platelets, the tiny clotting patches that rush to seal a cut. One cheap test reads all 3 teams at once. Now, before you panic at any one number, the most important idea in this whole video. A flag on your report is information, not a diagnosis. That little H or L just means a value sits outside the lab's usual range, and that range is simply where most healthy people fall. It is not a pass or fail line. It shifts with your age, your sex, with pregnancy, even with the altitude you live at. Labs differ from one another too. A mildly out-of-range value is extremely common and very often harmless, and one reading tells you far less than a trend over time. So read your report with your doctor, not with a search bar. Let us start with the number that matters most here in India: hemoglobin and anemia. If your hemoglobin is low, your blood is carrying less oxygen than it should. That can leave you tired, breathless on the stairs, looking pale, struggling to concentrate. Or when it comes on slowly, it can cause almost no symptoms at all, which is exactly why a simple test matters. Mild anemia is often completely silent, and it is the single most common thing a CBC uncovers in this country. And this is where India deserves a closer look, because anemia here is not rare or unusual. It is an everyday epidemic. By our National Health Survey, more than half of Indian women and most young children are anemic. The commonest reason is simply too little iron in the diet, though shortfalls of vitamin B12 and folate play a large part too, especially on largely vegetarian plates. The encouraging part is that iron-rich foods and the right test point the way forward, so it is rarely guesswork. But here is a trap worth knowing, and it is genuinely important in India. Not all small red cells mean iron. When hemoglobin is low and the cells are small, the obvious answer is iron deficiency. But there is a great mimic, Thalassemia trait, a common inherited carrier condition in this part of the world. It also produces small red cells, and no amount of iron will fix it. In fact, taking iron you do not actually need can do harm. So if iron tablets do not lift your count, ask your doctor about thalassemia. A simple blood test settles it, and it is genuinely worth knowing about before marriage or a pregnancy. Now to the second team, the white cells, where the story is all about patterns. A high white cell count can suggest your body is fighting an infection, or dealing with inflammation, or even just under physical stress. The breakdown adds detail. A rise in the type called neutrophils often points to a bacterial infection. A rise in lymphocytes, more often a viral one. A jump in eosinophils can mean allergy or asthma, and in India sometimes worms. A low count is frequently just a passing viral illness. But notice the careful word throughout, can suggest, never proves. The pattern simply guides your doctor to the next sensible step. Then the third team, platelets, and the question every Indian family asks in fever season: dengue. Platelets are your clotting cells, and they fall in dengue and other viral fevers and with some medicines. But here is the crucial calming point. In dengue, the platelet number on its own does not decide your treatment. Doctors watch the person and the warning signs far more than they watch a single figure. High platelets, on the other hand, are usually just the body reacting to an infection or to low iron. And sometimes a surprisingly low reading is simply the cells clumping in the test tube, which is why an odd result is often just repeated. And that brings us to the heart of this channel. No fear, just the why. A CBC is not a scorecard for your body, and a red flag on it is not a sentence. It is a calm, cheap, brilliant little snapshot. And almost every flag on it has an explanation that is findable and very often completely fixable. The fear we are dissolving is the fear of the page itself. So let us turn that fear into skill with one genuinely useful trick for reading a red cell flag. When the Haemoglobin is low, look at the size of the red cells, a value called MCV. If the cells are small, think iron deficiency, or that Thalassemia trait from a moment ago. If they are normal in size, think recent blood loss, or a longer-term illness the body has not caught up with. And if they are large, think low vitamin B12 or folate, which, as we said, is common on Indian diets. The size does not give you the diagnosis, but it is a wonderful clue, and it tells your doctor exactly which test to reach for next. So when is it actually worth getting a CBC? It is simple, cheap, and quietly powerful, so it earns its place often. If you have lasting tiredness or breathlessness, easy bruising, or frequent fevers and infections, it is usually the first, easiest look. It is a standard part of a routine health check, of getting ready for surgery, and of following a problem your doctor already knows about. You do not need to run one on a whims. But when something genuinely feels off, this little test is very often where the answer begins. Now the other side, because honesty matters. A few CBC results are not routine at all and need a doctor quickly. Very low Haemoglobin together with chest pain or real breathlessness. Very low platelets together with bleeding or a fever with a spreading rash. A very high white cell count or several of the cell lines dropping low together. These are the uncommon exceptions, and the great majority of flagged results are mild and nothing like emergencies. But they are exactly why you should never sit alone interpreting a worrying report off the internet. So the honest takeaway, read it calmly and read it with help. A CBC counts your blood's 3 teams: red cells for oxygen, white cells for defense, platelets for clotting. One flag is a clue, not a sentence. The size of your red cells often points to the cause, and a trend over time tells you more than any single snapshot. If you would like every line of a CBC on one plain English page, what each one means and when to actually worry, just comment the word honest, and we will send you our free cheat sheet. If this turned a wall of frightening numbers into something you can actually understand, that is exactly why we are here. Subscribe and send this to someone holding a report they are a little afraid to open. Will we make health make sense? One last important note. This is general information, not medical advice, and it cannot interpret your own report. Only your doctor, who knows your full story, can do that. Please do not start iron, vitamins, or any medicine based on a video. And if you have bleeding, severe breathlessness, or a high fever with a worsening rash, do not wait on a number, seek care promptly.